Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the fifth video of rapid revision course of endodontics, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about chronic pulpitis types. In fourth video we already discussed about normal pulp and acute pulpitis types like reversible, irreversible, and also we discussed about pulp necrosis. Now in this video we will discuss about three types of chronic pulpitis and also etiology of pulpal pathologies according to Grossman. Now first we start from etiology of pulpal pathologies according to Grossman. Basically, this etiology of according to Grossman is important in every type of exam. Now, Grossman divide the etiology of pulpal disease into three. Number one, physical. Number two, chemical, and number three, bacterial. Then in physical, again there are three subdivisions. Number one is mechanical, second is thermal, and third is electrical. Now first in mechanical, there is a trauma. If there is trauma to teeth, in the result there will be pulpal pathology. Second is a pathological wear. If there is a pathological wear like bruxism, atresion, in the result there will be exposure of pulp, in the result there will be pulpal pathology. Third is the cracked tooth syndrome. If a tooth become fracture, again the when pulp exposed, in the result there will be pulpal pathologies. And fourth is the barometric changes, mean pressure changes. Next is the thermal. In thermal there is a heat from cavity preparation. When we prepare tooth cavity, we should use the handpiece. In handpiece there should be water, because if during cavity preparation heat is generated, and this heat can traumatize the pulp. Second is the exothermic heat from setting of cement, like silicate cement. When they sit, they release heat due to exothermic reaction. Again, they will traumatize the pulp. Third is the conduction of temperature through defilling. If defilling conduct the temperature, like amalgam, again there will be trauma to pulp. Fourth is the friction heat caused by polishing gap restoration. If we polish the restoration, at that time we should use the water coolant, because this heat can trauma to the pulp. After thermal, come to the electrical. In electrical there is a galvanic current. This is due to amalgam filling. If opposite to amalgam filling there is a gold filling, like any metal filling, there will be galvanic current. Next in chemical there is a phosphoric acid, acrylic monomer, and next is a erosion. They again cause trauma to the pulp. Next in bacterial there is a toxin associated with caries. In caries, the bacterial toxin, they can cause pulpal pathology. Next is the direct invasion of pulp from caries or trauma. If due to trauma pulp exposed, there is a invasion of bacteria to that area, again there will be pulpal pathology. Next is the anacoresis. Anacoresis is a transmission of pathogens like bacteria from blood, through blood or lymphatic drainage, lymph system to the pulp. This is known as anacoresis, and it is mainly occur in bacteremia condition. When these bacteria come through blood or lymph to the pulp, again they will cause pulpal pathology. Now, after Grossman according to Grossman classification of causes of pulpal pathology, now come to the types of chronic pulpitis. In chronic pulpitis, first is the chronic hyperplastic pulpitis, also known as pulp polyp. Clinically, when we see the tooth, there will be soft tissue, mean the whole pulp chamber will be filled with the soft tissue, and there will be high bleeding from that tooth because this is an inflamed pulp. This is also known as pulp polyp. Now, what is chronic hyperplastic pulpitis? Chronic hyperplastic pulpitis is a productive pulpal inflammation due to an extensive carious exposure of a young pulp. It's characterized by development of granulation tissue covered at time with epithelium and resulting from long-standing low-grade irritation. If there's a long-standing low-grade irritation, there will be pulp polyp. In etiology, there is a slow progressive carious exposure. Pulp polyp develop in a tooth with a large open cavity having a young resistant pulp and a chronic low-grade stimulus. Mean patient will, in patient history, patient say from 1 year or 2 to 3 year, in my tooth there is a cavity and there is no pain. Now on biting I feel pain. There will be, mean if in that long duration 2 to 3 year, if tooth is carious and tooth is open, in the result there will be chronic hyperplastic pulpitis, and its cause is slow progressive irritation. Now, pulp polyp develop in tooth with a large open cavity having a young resistant pulp and a chronic low grade stimulus. Mechanical irritation and bacterial infection provide stimulus. In symptoms, it is asymptomatic except during mastication there will be pain. Now, in diagnosis, appearance of pulp polyp tissue clinically characterized of a fleshy reddish pulpal mass which fill the most of the pulp chamber. Mean the whole chamber will be filled with a soft tissue, fleshy red soft tissue. When we take radiograph, there will be large open cavity with direct access to the pulp chamber. There will be large open cavity and direct access to the pulp chamber. In thermal test, there will be no response, and in electric pulp test, there will be more current required than normal to produce a response, to elicit a response. In differential diagnosis, there is a gingival polyp. Sometimes when gingiva become inflamed, they invade the open cavity and look like a pulp polyp. But how we differentiate between pulp polyp and gingival polyp? We see the peduncle, mean from where the origin of the inflamed tissue. If peduncle is attached with the gingiva, it is gingival polyp. If peduncle is not attached with gingiva and from the pulp, then there will be pulp polyp, also known as proliferating gingival tissue or gingival polyp. In treatment, there will be elimination of pulpal tissue with a sharp curette or spoon excavator, followed by extirpation of pulp, provided the tooth can be restored. Bleeding can be, there will be severe bleeding, and bleeding can be controlled with a pressure pack, and pulpectomy can be complete in a single visit, mean root canal treatment. In chronic pulpitis, we will go for root canal treatment. Now come to the second types of chronic pulpitis, which is the chronic pulpitis closed form. In closed form, the tooth is normal, there is no carious cavity, but there is a pulpitis. Why? Because during operative procedure like polishing, we due to heat we damage the pulp. In chronic pulpitis, which is closed form, occur from operative procedure or due to trauma or periodontal lesion extending apically to the foramina of lateral canal. Excessive orthodontic movement may affect the vascular supply. When we apply orthodontic forces, may affect the vascular supply to the pulp, producing localized area of necrosis. But this chronic pulpitis is not open from the outside. Depending on the strength and duration of inciting irritant, pulpitis may be chronic from onset or become chronic after the acute response have subside. Initially, if we not treat the acute pulpitis, they become chronic. Its exacerbation by additional operative procedure and minimal pulp damage resolution may occur. It self-resolve. Next is the chronic pulpitis, which is the ulcerative or open form. In chronic pulpitis, ulcerative or open form, it is a chronic inflammation of cariously exposed pulp characterized by formation of an abscess at the point of exposure. At the point of exposure, in chronic ulcerative form or open form, there will be ulcer formation, and at that point, at ulcer, there will be abscess. And for chronic pulpitis closed form, open form, we use term used as a pulpal chronic abscess or pulpal granuloma. Now the abscess is surrounded by granulomation tissue. It can be partial or total. Now in the treatment of chronic pulpitis closed palm or open palm, we will go for it may resolve itself. If it is not resolved, especially in open form, then we go for root canal treatment. This is all about etiology of pulpal pathologies according to Grassman, and 3 types of chronic pulpitis: chronic hyperplastic pulpitis, which is known as pulp polyp. Second is a chronic pulpitis closed form, which is occur due to orthodontic heavy forces and operative procedure. And next is the chronic pulpitis, which is ulcerative or open form, which is the chronic pulpal abscess. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.